So here is part 3 of Got Shoulder Pain, and we've covered an introduction. We talked about common diagnoses last time. Now we're going to talk about some common treatments. But first, we're going to look at statistics, right? Because why is this such an important thing? Well, half of new episodes of shoulder pain do resolve in 2 to 3 months, right? It's a long time. That means half of them don't. And out of that half that don't, 40% of those cases persist for longer than a year. And recurrence and chronicity, which means it doesn't go away, rated as moderate to high. And many people with shoulder pain do not experience a complete resolution of symptoms, which means they've always got a little something going on. And 40 to 50% of those who experience shoulder pain report recurrence. So it comes back within 1 to 5 years later. 13% are still attending medical services during the 3rd year of follow-up. So this is a big deal, right? Another statistic, half of all new episodes of shoulder pain continue to show symptoms or recurrences at 6 months, with as many as 40% still with symptoms at 1 year. So this is all over the data. So why is this? What's going on? Why aren't we fixing it? So here are some common treatments: injections, medications, surgery. There's all different kinds of surgeries. And then you've got conventional PT, and I call it conventional PT because they see you as a shoulder that walks through the door. They don't believe it's attached to any other part of your body, and you're just a shoulder. Okay, so corticosteroid injections versus manual physical therapy or treatment of shoulder impingement syndrome. This is a study that looked at over 100 people who had shoulder impingement, and what they found was those who had manual PT had significant improvement in shoulder pain a month after treatment, with improvement continuing for a year after treatment. Corticosteroid injections, the same exact results. However, during the 1 year follow-up, they visited more doctors, more healthcare professionals, and had more procedures than the manual physical therapy group. So kind of says, well, maybe they didn't do as well, right? And then we talk about side effects of injections. Yeah, there are side effects. A lot of people are completely unaware of this. I'll never forget one of the best orthopedic surgeons in our area that there ever was. Amazing gifted surgeon, told 20 years ago at our department that you don't want to inject an area more than once because it will damage the tendons, it can damage the cartilage, and you just don't want to do it. So why are we doing it all over the place? And why is it nobody knows about these side effects? Or I should say the patients have no clue about the side effects, right? Now, I'm not saying if you're in horrible pain, you should suffer the rest of your life, but you at least need to be aware so you can make an informed decision, right? You need to make an informed decision. All right, let's look at surgery. And I didn't kind of cherry pick these. I just want to show you that it's not as great as we think it is. This particular study said no evidence was found in favor of any non-surgical, surgical, or post-surgical intervention. More research is clearly needed. And they were looking at current evidence for effectiveness of interventions, right? This was a great big systematic review. And then, of course, surgery, there are risks. You can get nerve injuries. There's all kinds of problems that can happen from surgery. And if you've ever had it, or you know anybody who has, you know how long it takes to recover, right? Here's some more statistics. The extent of tissue damage observed on clinical imaging does not correlate with shoulder pain intensity. So that means it's not really all that relevant to diagnose structural pathology in people who have pain just based on imaging, because it doesn't always line up. There are people who show stuff on imaging who have no symptoms, and vice versa. So it doesn't mean that one means the other, right? And it's also been shown in the general population, 2 to 4 people out of 10 have no symptoms, but they show rotator cuff tears. So again, structural pathology may not fully explain the reason for the pain. So what if that tear has nothing to do with your shoulder pain and you have surgery? Uh-oh, you're still no better and you've had surgery, right? And then we talk about decompression surgery. Here's a study. Non-surgical treatment is recommended first, at least 3 to 4 months, at least. And research suggests that patients who give non-surgical treatments worthwhile effort can possibly avoid surgery and have the same outcomes to those who had surgery. And then we come to physical therapy modalities: hot pack, cold packs, ultrasound, electrical stimulation. Well, guess what? Multiple systematic reviews do not support the effectiveness of ultrasound when it's used for shoulder pain, right? Or adhesive capsulitis or subacromial or rotator cuff related shoulder pain. Now, there's some evidence that ultrasound results in improvement compared to placebo when specifically used for pain with calcific lesions of the rotator cuff. But that's an extremely small population, and you've got to know that's the reason, right? And there's very limited evidence for the efficacy or effectiveness of most electrotherapy modalities in the management of shoulder pain. And then when it comes to your conventional physical therapy exercises, again, they're going after the rotator cuff most of the time. You need to be seen as a whole person and not a shoulder that walks through the door. And we're going to talk about, what can actually work at the end of this series. So remember that most important question to ask when you're advised to do something: how effective is it at fixing my problem? And what are the risks? All right, we'll see you next time.